Are you a nurse practitioner student struggling to pass advanced pathophys? You may be the problem. If you don't know me, hi, my name is Nikki. I'm an acute care nurse practitioner and I work with NPs and NP students to help them be more successful in their careers. Advanced pathophys is one of the 3 Ps, one of the core foundations that you will need for diagnostic reasoning once you get into the clinical courses while you're in nurse practitioner school. And a lot of students fail themselves by trying to study the same way they did in RN school. However, you're no longer in RN school and you have to approach the information as a provider. Advanced pathophys introduces a large volume of very complex information over a short period of time. You cannot memorize the volume of information that is being presented, and that is how I see a lot of students approach this content, and it's just not possible. I have watched students rewrite their whole textbook making outlines and notes, but still never picking out the key concepts or the key information that they will need for their diagnostic reasoning. So when you're picking out information, or if you've already made an outline, I want you to make sure that you have these 3 pieces of information clearly covered, and these are the things that you're mastering. 1, what is the mechanism of action of this process? So you have to understand how the process is broken. What is the mechanism of action of this disease process, this concept, or this condition? Number 2, what are the risk factors? As part of diagnostic reasoning, you will have to understand risk factors. So you should be looking for what are the most common risk factors for, again, this disease, this process, or this condition. And then the third part is, what does it look like? How does it present? And that is not limited to just the hallmark signs. You should know the whole body physical presentation. Is there a fever? Is there tachycardia? Is there pain? And not just a hallmark sign. For example, most nurses know that cellulitis presents and it's red and it's hot and it's painful to touch. It may be edematous, but what other presentation symptoms do you need to be looking for? Is there a fever? Is there distress? Is there tachycardia? You want to know the whole big picture of presentation and not just one specific hallmark symptom. Those are important, but most of the time you're going to be familiar with those anyway. Without mastery of pathophysiology, you are going to struggle with differential diagnoses and you're going to struggle with diagnostic reasoning. You only have a short period of time to master this information. Your time is your most valuable asset when you are in grad school, so use it wisely. Pick out the information that is going to be important and applicable and be able to master that and not just memorize it. If you have questions about pathophysiology or diagnostic reason, put them down in the comments. And if you like my content, please follow me for more.